Hello, good afternoon. Welcome to Journey today. We're coming to you live from our studios in Kokomlemi. We're on DTT because we're free to on DSTV channel 421 and Go TV channel 125. We are your home of independent, fearless, and credible journalism. Coming up this afternoon, Asante Otumfo said to the second joins calls for the retooling of Komfo Anokye Teaching Hospital after doctors at the oncology unit called off the two-day strike. Also this afternoon, Trade and Industry Minister Katie Hammond remains resolute on cement price regulation, insisting on disregarding petition from cement manufacturers.
In case of body corporate, every director and officer of that body corporate is deemed to have committed that offense, if it is the case that you have got the offense.
We have a response from the minority in Parliament who say the airline is not the solution to the price hikes, but rather removal of incessant taxes on imports, among other things. We'll also take you live to Parliament where there's a pre-laying meeting. Also, there's academic activities on halt at the Accra College of Education as the strike by members of the Colleges of Education Teachers Association, CTAG, enters its 14th day. We are live on Facebook, YouTube, Instagram, and X Spaces at Joining Zone TV. My personal handle is @Denana Aisha. Please do stay for details. Asante Otumfo said to the second has added his voice to calls for the retooling of the Komfo Anokye Teaching Hospital. His call follows a two-day strike by some doctors of the oncology department of the hospital to demand for the activation of essential equipment in the treatment of cancer patients. Though the doctors have called off their strike, the Asante says many lives are under threat by the absence of those essential equipment at the facility. Nanaya Ojima visited the hospital with the health minister and has filed this report.
The Asante is appalled by the absence of essential equipment for healthcare delivery. His checks at the cardio unit of the Komfo Anokye Teaching Hospital has revealed the need for some life-saving equipment at the facility.
We struggle with basic equipment. Dialysis machines are hard to come by here. They tell me Kath lacks some life-saving equipment. If I have an emergency and I am taken there, they may not be able to treat me. Where do they take me then? By the time I am taken to Accra, something bad would have happened.
The need for retooling of the hospital was also emphasized by management of the hospital when the health minister visited. Explaining the strike embarked by some doctors, the chief executive of the hospital, Professor Oche Ademensa, says the facility has incurred a huge cost of fixing the LINAC machine at the oncology department. But for the effective use of the machine, there was need to acquire a water phantom at $109,000 for the calibration after inability to fix the machine. Professor Ademensa explains the necessary measures had been taken to procure the equipment before the strike.
The water phantom had also broken down, and there was a need to either fix it or get a new one. Our engineers tried very hard and then realized that we needed to buy one at the end of the day because they could not fix it. They cost $109,000, which was not budgeted for. But we were convinced that given the fact that Komfo Anokye is the second cancer center in Ghana, public, there was a need for us to fix it so that the number of patients who were coming here with various cancers could be attended to. So we started the processes. The LCs were done and sent out. Unfortunately, we had a letter sent to us by about 9 doctors from oncology to say that it has taken too long for the machine to be fixed, and that by a certain date, if the machine was not fixed, they were not going to see patients.
Health Minister Dr. Bernard Okoboy has assured of working with the hospital to realize the set objectives.
I mean, anyone who finds himself or herself in the middle belt, should you get a medical emergency, you are likely to land here, depending on the degree of the emergency. So, working together with CATH to address your challenges is in our interest. All of us are interested. Because the next time I might be the one in these 2,500 visits, my count might be in. I want to give you the assurance that we'll work speedily to help the retooling. Hospitals like this, because of the numbers, sometimes even when you get equipment or tools, within a short time, you need replacement and all that. So we appreciate the concerns, and we are going to work closely with you.
Meanwhile, the Ministry of Health has donated 100,000 cedis towards the Heal Komfo project, which is aimed at renovating parts of the hospital. For Joy News, Nanaya Ojima, Kumasi.
Meanwhile, Health Minister Dr. Bernard Okoboy has dismissed assertions that the government is eager to complete hospital projects in the Ashanti region for political gains. The minister, who is touring the region, says the government will see to the completion of the Swame and Seria hospitals by September this year. According to him, the projects started years ago are critical to improving universal health coverage in the country.
For years, the government has been under intense pressure to complete some health facilities under construction in the Ashanti region. The Health Minister, Dr. Bernard Okoboy, on a tour of the Ashanti region, has been given deadlines for commissioning of some projects.
I had to read this to remind all of us that good things don't happen in a day. They happen over a period. And this reminder is important because we are in an election year. So that if you see a facility like this being commissioned in September and God willing in October, people entering to have access, remember that it was birthed or conceived way back in 2020.
The Sewa and Swame hospitals are scheduled for completion in September. Under the Vamed hospital projects, 12 hospitals were to be constructed in 4 regions. The 71.5 million euro contract, awarded in August 2020, was to be completed in 24 months, but has been delayed due to domestic debt exchange program. 5 of the facilities under this project are in the Ashanti region. At the Swame Hospital, civil works are 95% complete as medical equipment installation reaches 70%.
And by the way, all this is outside Agenda 111. Sometimes the impression is created that Agenda 111 is now coming to add health facilities to our stock. Many health facilities have been worked on by this government. Agenda 111 is only coming to complement all that we've done. And by the way, this facility is the typical model of a very fit-for-purpose primary health care facility. When we say primary health care, the basic things that a community will require.
Poor road network to the hospital may affect operationalization of the facility, but the minister has committed to an upgrade of the roads. The Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, is upbeat about the contribution of the project to the universal health coverage.
We are doing about 50% according to UN system data. 50%. But the greatest challenge we have is what we call the peri-urban areas. It's the peri-urban areas who live in the towns but they don't have access to care. Because if someone lives here in the morning attempting to go to Komfo or anywhere, it takes them such a long time. So bringing such a facility within that community is really something that is going to be very helpful to make people access care more easily, and also the thing that prevent people from using care. Travel time, geographical access is extremely important.
works on the 507-bed capacity mother and baby unit at the Komfo Anokye Teaching Hospital has resumed after the successful implementation of the domestic debt exchange program.
And I think we also need to remember that we had an old mother and child, which has been the biggest and longest surviving white elephant in the country. Started by a champon. I say it's the biggest white elephant because it was too big to ignore. And I'm happy we have a president who had the courage not to ignore like the predecessors.
For Joy News, Nana Ojima, Kumasi.
This afternoon, there's a warning that Ghana's health system is in a precarious state and the situation might even worsen as a result of the mass exodus of health professionals, especially doctors and nurses. The latest Ghana Human Development Report themed the future value of work in Ghana asserts that 24% of nurses trained in Ghana are currently working abroad due to poor working conditions. The situation is even more critical for doctors trained in Ghana, with 50% having left the country. The document, authored by the United Nations Development Program Ghana in partnership with the Statistical Service and the National Development Planning Commission, states the health sector requires policy and pragmatic measures to avert a total shutdown of the sector. There's more in this report.
What? Yeah! There you go! The launch of the
A celebration heralding the launch of the National Human Development Report. According to the United Nations Development Program in Ghana, this piece of document is vital in assessing the state of human development in Ghana.
Now, National Human Development Reports are a crucial tool for assessing the state of human development in a country. And they also provide a comprehensive analysis of various socioeconomic indicators, helping us understand where we stand and what needs to be done to improve the quality of life for all.
This has become very topical. Everywhere, people are talking about the future of work. Yes, because we are going through a very significant transition, and more or less they term it a revolution. The fourth one, of course, and the Industrial Revolution brings to us the challenge of the work that is coming back to us in the future. It means that if we don't organize ourselves, we might not be fit for that work, or if we don't organize ourselves, the work might not be there for us.
Released by the United Nations Development Program in Ghana in partnership with some other state agencies, the report highlighted major issues in the labor market in some thematic areas, including the health sector, which is experiencing a mass exodus of health professionals. So far, it is estimated that about 50% of doctors trained in Ghana are now working abroad. The rate is 24% for nurses, who equally lament poor working conditions in Ghana. Professor Samuel Kobina Inim is government statistician.
I mean, definitely once you have your professionals moving out of the country, it's an issue of concern. But we always have to look at these numbers in the context of the targets that we have. For every country, you expect a natural out-migration, but the question is it consistent with the target relative to the numbers that you are training and the numbers that you expect to be retained in this country? So this is where we refer our discussions to what the policy documents are when it comes to the numbers that we are training, the numbers that we expect to be retained, and obviously the numbers that we don't have control over that would exit. I don't have on top of my head what the statistical targets are on these issues, but definitely going forward, these are some of the contextual discussions that we're going to have.
Meanwhile, the United Nations Development Program resident representative in Ghana, Angela Lusigi, believes that the data shows there is a strong supply chain which the government and authorities could leverage using effective national policies.
I think it's very interesting that there is an external market for Ghanaian nurses and doctors, and it means that there's a strong supply chain. So the question for me is, how are we taking advantage of the strong supply chain of doctors and nurses in the country to create opportunities for them to work both here in Ghana and abroad? I think COVID taught us the importance of planning ahead for the next pandemic, and also how do we use technology to be able to improve the working conditions for nurses and doctors in this country.
The National Human Development Report is expected to serve as a guiding framework for policymakers to work towards building a more inclusive society. Blessed Sugan's report for Joy News, Accra.
Cement manufacturers face up to 3 years in jail under proposed legislation to regulate prices. Trade and Industry Minister Katie Hammond has been defending its latest controversial proposal to regulate the prices of cement in the country. He's been speaking exclusively to hosts of PM Express, Evans Mensah. Mr. Hammond insists the LI is necessary to prevent a cartel of manufacturers from exploiting the public. If the LI is approved, cement manufacturers could face up to 3 years in jail for violations. Despite opposition from the minority in Parliament and various interest groups, the minister remains firm in his decision. He made these remarks during an interview with Evans Mensah on PM Express.
They decide not to comply at the peril of the penalty.
What penalties are you proposing?
Well, it's pretty hefty.
Well, that's what I would like to know, yes.
No, I'll tell you, 3 years imprisonment, or both, of fine and imprisonment. So, yeah, a person who contravenes what I've just indicated to you is liable conviction to the penalty points. We're talking about 2,500. The unit points, I think the multiplication of 12 or something is 2,500 penalty units. You convert that, I think it's 12 cities or whatever. So how much that one comes to is the fine. And then maximum 4,000 penalty units. And that's what see, these companies, they are big ones. So if you limit them to fines, they will easily pay the fines and then come back and replicate the same whatever they want to do. So there's a stiffer one here. Now, imprisonment of not less than 2 years, and of course not more than 3 years, or both, fine and distance. But we don't leave it at that. You know, corporate responsibility and corporate whatever. So you well be thinking that, well, you can't put a company into prison. And so we go on to make clear that if it's a corporate...
who specifically suffers this?
So here, you know, you want to hear...
If you can detail that part.
You want to hear that one?
Yes, I want.
But you're not a company director in any of the cement manufacturers.
For public education, yes. Who suffers that?
All right, so we have it here. In case of body corporate, every director and officer of that body corporate is deemed to have committed that offense, if it is the case that you have the offense. In case of a firm partnership, you know, the firms and partnership, they have a different categorization. Every member, management, the firm of medicine, any concern with the management of the firm is deemed to have committed that offense. So,
so the manufacturers then will bear this penalty.
Yes,
that's
not the
individual. So for the directors of the manufacturing company. So if this is an example. Sure. If it is the Jata manufacturing company, the directors, if they put out cement on the market at the price above the price ceiling,
exactly the ceiling,
then they will.
And you see the ceiling, and I think we should be comfortable about this. The ceiling is not going to be unilateral.
Well, I've been joined by the ranking member of the Trade and Industry Committee of Parliament, Yusuf Suleimana, for more on this. Honourable, the Minister for Trade and Industry is optimistic the minority in Parliament will support him on this one.
Good afternoon to your viewers. And to start with, I want to say that it's unfortunate that the minority will not support the minister. The minority will not support the minister because we want to look at the legal.
Kindly unmute for me, Mr. Suleimana, Yusuf. Mr. Suleimana, kindly unmute for me. there seemed to be a connection problem. We'll try and bring him back. But do we have you, Mr. Suleiman? Are you safe?
Yes,
right,
I'm here.
Right, we lost you.
Sorry, I was saying that it's unfortunate that the minister will not get our buy-in. He won't get our buy-in because we want to subject this legislative instrument to its constitutionality. And he made reference to Section 80 FR of the GSA Act 1078/2022. If you have that act there, please look at it very well and look at the section very well, and whether or not the minister has the legal right to introduce price control regime, you will get to know. That is the first issue. The second issue is that I have started raising issues about high prices of cement, not today. It's on record. I even read a statement on the floor of Parliament, and I made proposals. The proposals, among others, is, for instance, for us to look at the tax regime of these manufacturers. Take, for instance, a levy that is imposed on clinker when it's imported into this country. Now, that levy is referred to as fumigation levy, but you do not do any fumigation, yet you charge a levy. This goes into the manufacturing cost. And of course, this will also reflect when it comes to the sales price. That is one. Two, look at the situation where you have only one decking place for clinker that is imported into Ghana, okay? What it means is that you have traffic at the ports, and so most of them will have to also pay a demurrage between $35,000 to $45,000 per container. This will also reflect in the cost price or in the manufacturing of the commodity, and for that matter, the selling price. Government has control over some of these things. Can government engage the manufacturers so that we are able to reduce some of these things? We can take up the fumigation levy. It's unnecessary. After all, you are not offering that exercise.
What do you intend to do? What do you intend to do, Mr. Suleimana, because that airline matures in 21 days?
Yes, so as I speak to you, when he brought it to Parliament, he was advised once again to go through what we call the pre-laying process. And as I speak to you, the subsidiary legislation committee is looking at it. And I believe that they will raise some of these issues that I'm raising, that it is not lawful, and that we should do further consultations. And it's only when we do that that we can come to a compromise position. But let me put it on record. The minority is not saying that prices of cement are not high. We are not saying that the cost of buying cement should be borne by only the buyer. What we are saying is that government can do something about it so that prices will come down even before we think about legislation.
I'm grateful for your time. Yusuf Suleimana is ranking member on the Trade and Industry Committee of Parliament. Just as he's put it, there's a subsidiary legislation committee pre-laying meeting ongoing right now. 6 members from the minority are present. 2 members from the majority are also present, with the MP for Dominic Ayeni presiding and the minister himself in attendance. I've been joined by Parliamentary Affairs correspondent Kwekwa Sante for more on this. Kwekwa Sante, what are you picking from this pre-laying meeting?
Well, Aisha, this meeting is happening right behind me in that office. That is the Second Deputy Speaker, Andrew Amakwensiame's office. A conference room is what is hosting the Subsidiary Legislation Committee as they meet the Minister for Trade and Industry, Katie Hammond. Like you said, at the start of the meeting, there were about 6 minority MPs and there were about 2 majority MPs. A little more, about 2 or 3 NDC MPs have joined. The majority MPs haven't gone up, but the meeting has started because there is quorum. And as we speak, the minority are continuing to make their case. Of course, friends of the committee like Dr. Bernard Ahiapo, for instance, is in this committee meeting. They are trying to legislate. They are trying to find out whether this subsidiary legislation, the airline that is coming in, sits in consonance with the parent law, that is the Ghana Standards Authority Act. And so they are trying to do that. They are trying to get that. They are also trying to get the kind of understanding that the Minister for Trade and Industry, Katie Hammond, is using, and that is behind this legislation. Of course, as we just heard from Mr. Suleimana, this has become a political football. The NDC minority really believe that the government can't do something about the price of cement without having to pass the legislation. They talk about taxes, they talk about the city's performance currently. They believe that if all these issues are looked at, then the price of cement will come down. For instance, a leading member of the minority that I spoke to yesterday tells me that the minister is just trying to obfuscate the issue, trying to lay the blame on the cement manufacturers, when really it is government, quote-unquote, incompetence that is leading the cement prices to go up. So the meeting is currently underway. We expect that it will conclude maybe in the next hour or two, and then they can prepare a report, probably present that to the House tomorrow or as soon as Tuesday, and then the way forward as whether or not this airline will be laid or not can be made.
What other business are the MPs conducting today, Kweku?
Well, the House hasn't started sitting because it's a Thursday. We know that Tuesdays and Thursdays, the minority leader is on trial for allegedly causing financial loss to the state, for which reason the minority have always said they will boycott proceedings without their leader in the House. So there's a compromise that has been reached between both the minority and majority leadership that whenever the leader is in court, the sitting will start after the court proceedings. So House hasn't started sitting, I haven't started an order paper yet, but we know that there will be questions, there will be issues about this airline that will quite come up on the floor when the sitting starts somewhere around 2 or 3 p.m.
Kweku Asante is our correspondent in Parliament. We'll bring you more from Parliament as the events in Parliament unfold. Now, students at the Accra College of Education are still bearing the brunt of the strike and backed upon by the Colleges of Education Teachers Association of Ghana, CTAG, since June 14. Academic activities on campus have been grounded to a halt, with students compelled to study on their own or in groups while their lecturers are away. Some of the students that spoke to Joy News called on government to address the concerns of the lecturers so academic activities can resume.
The strike actually has not been live positively, honestly. As students, we are here to learn and then get something out of the day. But as of now, the strike is on the 14th day. And then students, we are just sleeping, waking up like Adidas, literally. And there's nothing we are doing when it comes to academics because lectures are not back on campus. We can have slides to read, we can have manuals to go on and then even online to get something to read. But what is the knowledge of the teacher backing it when you don't even have a fair knowledge about it? So we, the students, actually, we are not enjoying the strike at all.
Some of us need a guidance. We need a guidance from the lecturers. So, like, as the strikes come, it's affecting us a lot. It's affecting us. So, I'm just pleading with the government to do what the lectures are.
Demanding.
So that we the students to feel comfortable to study more.
Since the strike began, how have you been studying? Have you been studying on your own in a group, or you've not been studying at all?
As the strike comes, in particular, I've not been studying because there are some courses we need a lecturer, like you see, here to control us.
Thank you for the opportunity to voice our grievances to you. The 14th day of the strike is it's something that is affecting the students, everyone on campus, especially the level founders who are due to complete on September. But because of the strike, we don't know whether it is going to be extended or something. Then with the level 300s, 200s, and 100 that we are currently residing on campus, it's affecting us because there are some courses which is very technical. There are some courses that you need the knowledge of the lecturers to go into. For example, my courses, I'm doing mathematics and ICT. So I'm doing advanced teaching and assessing mathematics advanced. And with that course, it's very technical. Likewise, I have action research, which is also technical. I have the slide, I have the course manual and everything I can read on myself. But since the course is very technical, I need the
In Kumasi, the academic calendar of the Wesley College of Education has been significantly disrupted, with activities coming to a halt Due to the strike by CTAC, the situation is causing growing concern among students and other stakeholders who are calling for an urgent resolution to the stalemate. I've been joined by Nana Boache Yadom, who visited the school for more. Nana Boache, what is the situation on campus as we speak?
Well, Aisha, as we speak, the prolonged strike by CTAC is really biting hard on the Wesley College of Education campus. As I speak to you, a number of students are here as classrooms are being locked. They are sitting under trees, interacting amongst themselves as their hopes hangs in the balance as to when they would be writing their final examination or their end of semester examination. A number of them, you can see behind me, are interacting with their colleagues. Teachers are also gathered in a way, interacting amongst themselves, as we understand that the National Labour Commission is having a meeting with the CTAG in itself. And so on the campus of the Wesley College of Education, the situation is dire as students are crying on to the CTAG to call off the strike, to resume to the classroom or return to the classroom for them to be able to write their end of semester examination. Nana Boache, done with that update from the Wesley College campus. We'll be bringing you more in our subsequent bulletins. Let's take a break on Joy News today. When we return, there's more from business.
Welcome back to Joy News today. My name is Winston Taki, and now to our first business story. Leading telecommunications company MTN Ghana has reiterated its commitment to leverage technology to address risks associated with lending in the small and medium scale sector. Speaking at MTN Ghana's Business Executive Breakfast Series on bridging the credit risk gap for SMEs, Chief Executive of Mobile Money Limited, Shaibu Haruna, noted that effective collaborations with lending institutions will enhance the current risk assessment. Here is more.
The practice of identifying, assessing, and mitigating potential risks associated with extending credit to individuals and businesses in the small and medium-scale sector has been a major hurdle for lending institutions. The introduction of credit reference bureaus by the Bank of Ghana has greatly improved credit risk assessment of potential loan applicants in the country. In the absence of a proper de-risking facility, some SMEs, especially those in the agri sector, are still handicapped. Speaking at MTN Ghana's Business Executive Breakfast Series on bridging the credit risk gap for SMEs, Chief Executive of Mobile Money Limited, Shaibu Haruna, noted that the use of technology and effective collaborations with lending institutions will enhance the current risk assessment regime.
For us in MTN, we believe that we have the technology that will enable us address the issues around the risk of default of customers, and this we are doing by using customer transaction data in order to be able to predict the ability to pay and also the risk around default. And based on their transaction behavior, we can profile them in terms of the levels of credit that we're able to provide them in partnership with the banks and other financial service providers.
Meanwhile, CEO of AS Farms and a panelist on the forum, Kwame Enimsumwa, called for a review of interest rates based on the credit ratings of entrepreneurs.
Once the credit scoring is in place, then I think the interest rates should be structured in a way that it actually reflects on your credit score. It shouldn't be a blanket score for everybody because you are going to this sector. But then individually, the credit score, the credit scoring and models for drafting it should include your credit rating, which will help drive the interest rates a bit low for us.
Chief Enterprise Business Officer at MTN, Angela Mensah-Poku, reiterated the telecom giant's commitment to collaborate with relevant stakeholders in developing solutions for the SME sector.
There's a lot more we can do when it comes to products and services by listening to our customers and making sure that we have deep insights that is reflective of our customers' needs. So my commitment is definitely that for SME Month, we won't just talk about it, we won't talk about the big English, but we'll bring more practical and collaborative solutions.
The topic for this edition of MTN Ghana's Executive Breakfast Series was Bridging the Credit Risk Gap for SMEs.
As a participating member of the African Continental Free Trade Area, calls have intensified for interventions and policies which will promote women-led businesses to harness the opportunities presented by AFTA. In an interview with Joy Business, founder of Creed Ghana, Gifty Volim Karime, explains that tailored policies will be needed to support women entrepreneurs scale up and compete on the global market. She spoke at the launch of the Bridging the Digital Divide for Inclusive Value Chain Development project.
Policies around social enterprising and then also registration to align this are very critical, and the government is working with the Ghana Enterprise Agency. Initially getting Standard Board to approve, especially those that are into manufacturing, was very challenging, but now there is a system in place. When you work with them, they are able to waive some of the charges and you can get the approvals on time. So I think that is good, even though there's still a lot of work to be done, because we still have some barriers to cross, but it's been a great opportunity to do that. With AFTA, I think the piece also would be looking at the fair trade components as well, so that the women can fully get acquainted with those standards to be able to compete globally in terms of the businesses that they are and the products and services they are providing.
That'll be all for business here on Joy News today. My name is Winston Taki. We'll be back with sports after this break. Stay tuned.
Good afternoon, everyone. Welcome to Sports here on Joy News today with me, Muftao Nabila Abdullah. This week, we are bringing you a conversation with Reverend Osei Kofi on Prime Take. He's speaking on a plethora of issues, ranging from how he and Robert Mensah swallowed cowries during their playing days at Kumasi Asante Kotoko, and how that led to the demise. He also spoke about how the Ghana Football Association has allowed former footballers to become destitute in society. This is an excerpt of our conversation with him.
I was standing with Abukari, and I like Abukari and I love him. I saw somebody coming, and the way he was running towards us, I told Abu that it is because of us. Others were fighting, and he wanted to come and disturb us. Then Abukari said, Osei, stand at my back. Then he removed some belt.
As an amulet or something?
Amulet. And put it in his hand. When the guy came, Abukari just raised it, and the man, as if somebody has booted him, fell down, boom! Abu couldn't speak the Twi language, so he said, and Tokwa one started crying, Akwano Afrika. It means we haven't started the fight.
The fight, but he's already on the floor.
He's already on the floor. Then I understood something. That during our days, when we had to play House of Kotoko, we contribute money for Abu to travel to Tamale. When you go to Tamale and come back, we know he has one goal against us. And I will also score. So during our time, the way we were troubling House of Oaks.
I heard you swallowed cowries.
Hey, who told you? And unfortunately, that brought the end of Robert Mensah. When we returned from Britain in 1968, before leaving, there was a league going on. Yes. But we asked permission that when we come back now, we will play the remaining matches as outstanding.
So you swallowed the cowries?
I'm telling you the story, then you are drinking the soup of it.
And Prime Day will be coming your way on the AM show at 7:30 a.m. on Friday. Now let's hear from the Technical Director of the Ghana Football Association, Mr. Kingston, who has been speaking about how the elite football competition that has been organized by the Ghana Football Association would be a project that will unearth the best talents in this country.
Let me start with the long-term objective. The whole long-term goal or target is to unearth talents, develop talents, and develop the youth for our youth national team so that they can feed into the senior national team. For the short-term project is to scout the northern regions, the 3 northern regions, in terms of the talents that they have, Upper East, Upper West, and Northern region, and put them in the academy, which is set up in Congo with Bolga Secondary School, Big Boss. We have already started the process to establish a second one in Ashanti region, Kumasi specifically, which will comprise of Brown Ahafo region and then Ashanti region, students recruited from the basic schools to that academy. And then the same year, this 2024, we are opening another one in Greater Accra region. Hopefully it will be in Pram. Then going forward, the target is to get every region one academy. So in all, we are looking at the 10 regional football regions. So maybe in the next 5, 6, 7 years, each region will have its own academy. And that is where you can assemble all the best talents for each region. And then from there, we tap from the pool, and then they feed the youth national teams, and then grow to be part of the senior national teams for both boys and girls. My long-term goal is that Ghana should not run out of talent. Ghana should be the chain. The supply chain should keep going. And as a result, our target is to be in the World Cup, and if possible, conquer the world.
That's your sports for now. We do have more sports stories on myjoyonline.com.
Time now for showbiz, and the world's biggest record labels are turning up the volume on a legal battle against 2 AI startups, Suno and Audio, for allegedly remixing copyrighted music on an almost unimaginable scale. The case brought by Sony Music, Universal Music Group, and Warner Records could set a new legal precedent for the music industry.
In a potentially game-changing lawsuit, major record labels Sony Music Entertainment, Universal Music Group, and Warner Records have joined forces to sue AI startups Suno and Udio over claims of rampant copyright infringement. The labels accuse the companies of using AI to spit out music that closely mimics copyrighted works, seeking a hefty $150,000. The lawsuit, revealed on Monday by the Recording Industry Association of America, are part of a broader wave of legal actions by various creators challenging AI's use of their work. The cases have been filed in federal courts in Boston against Suno AI and in New York against Uncharted Labs, the developer of Video AI. Suno AI CEO Mickey Schulman has pushed back against allegations, stating that their technology generates completely new output and does not memorize or regurgitate pre-existing content. According to Schulman, the software does not allow users to reference specific artists. This lawsuit follows a public outcry from over 200 artists, including music legends Stevie Wonder, Billie Eilish, Robert Smith, and Nicki Minaj. They have all signed an open letter condemning the predatory use of AI in the music industry.
And for today's Throwback Thursday, we're taking you down memory lane to revisit the cherished Our Day tradition in Ghana. This special day, a highlight for kids in the late 80s and 90s, was almost as exciting as Christmas Eve, filled with colorful outfits, delicious treats, and joyful memories. My colleague Jacqueline Ansumayabua has more.
Growing up in Ghana, Our Day was a standout day for every schoolboy and girl. This was the day you get to wear that special outfit, say for December. The highlight of the day was the food packed in colorful baskets. Kids enjoyed extra chicken on their carefully prepared jollof rice or any other meal, mostly rice. Alongside were treats like Parley biscuit, digestive biscuit for the more privileged, and drinks like Fanta, squashed or refresh. The fun didn't stop there. Hello Happy Toffees added a sweet touch to the festive day. When our day coincided with December, the excitement doubled as friends exchanged gifts. This was also a time for kids to receive that extra pocket money. Walking to school on our day was a parade of happiness. Kids beamed with smiles, flaunting their goodies and shouting, "Our day, our day." The school environment transformed into colorful celebrations. Well, at the end of the day, the question your parents might ask you is, what was your position in class? Or where is your report card? While our day traditions still exist, they have evolved over time. What is your fondest Our Day memory? For Joy News, I am Jacqueline Ansuma Yabua.
And on that Our Day note, we end the bulletin. My name is Aisha Prime. Log on to myjournline.com for more of the news and updates of all the developing stories. So enjoy the rest of our programs.